us be together, aspire to achieve. No matter what, no matter when, together we will stand. Let us never be afraid. If we have to change our ways, through the years we'll always stay one in every way.
Together we make a difference, one voice, one destiny. We remain undivided, our hearts in harmony. Together we make a difference, our friends, our families. We'll stand strong, we'll never quit. Together we feel the Singapore heartbeat. Together we make a difference, one voice, one destiny. We remain undivided,
our hearts in harmony.
Together we make a difference, our friends, our families. We'll take care of you and me. Together we feel the Singapore heartbeat. The Singapore heartbeat.
Hello everyone, good evening. This is my maiden attempt to engage residents and everyone out there through live streaming. Personally, I've actually been interviewed before, but this is my first time hosting it, and I'll be having some help with a couple of wonderful ladies, grassroots leaders, and ladies who are working in the healthcare sector. They're in the front line. And so I thought that would be an interesting sharing that we could have today. So this is really my first try, and we're trying to bring everybody in right now. So bear with us as we navigate this digital platform, and I hope we be able to enjoy the conversations with all the ladies here. Hello everyone, good to see you.
Hi.
Thank you so much for humoring me with this effort. Thank you for taking your time this evening. Hopefully, this is something that we can use as a meaningful engagement with the rest of the residents of Bukit Batok East. So you may know them, they're all familiar faces, all the grassroots leaders within our community. I thought maybe we'll start off just basically introducing ourselves and telling us a little bit about where you work, because I think that's one interesting thing about you guys. So okay, at random, I'll just start maybe with Paysin first. Tell us about yourself, what you do, and maybe the grassroots work you do at Bukit Batok East as well. Go ahead, Paysin.
Yeah, hello, madam and everyone. I'm Paysin. I'm working as an allied health professional at a community hospital, doing mainly rehabilitation with elderly. I've been working for more than 10 years in the same workplace, and actually it's my first job since graduation, so I've been there for like more than 10 years. I'm happy to be here and look forward to the session. Yeah.
Thanks. Thank you so much, Paysin. So let's move to maybe Ruth. Ruth, how are you? Good to see you here. Maybe you share a little about your work.
Hi, I'm Indra Ruth. I'm working as a healthcare assistant in SGH for 11 years. I'm working in a clinic, and my job scope is in the clinic, we do assist the doctors. It's in the orthopedic line, so I have to assist in the front line and do a lot of work like clerking, then go with the documents, dispatch, so all the things. And I'm a ISC member in grassroots, so we are serving there also. 10 years I'm serving there, so that's my duty, and very glad to be in this online with you all.
Thank you so much, Ruth. Yeah, thanks. And yeah, maybe Noor, how's your Ramadan? You broke fast already?
Hi, madam. Yeah, it was like an hours ago.
2 hours ago.
Yeah. Okay. Okay. My name is Noor. I've been working in the healthcare industry for many years. But now currently I'm at a specialist outpatient clinic at NUH. I'm leader patient care
Oh, I
associate.
think we may be
Mm,
experiencing some. Give us a
yeah.
second, yeah. Okay, let me check.
So, madam, actually, I'm so excited to be invited in this hangout section. Yeah.
Okay. Sorry, could you just repeat a little bit about where you were, because I think we got cut out for a little while
Okay,
just
sure,
now.
sure. I'm at NUH specialist outpatient clinic as a patient care associate. We are actually assisting doctor in the consultation room by giving the patients appointment, the next appointment, direct them where to go for the pharmacy and those things lah. Yeah.
Hmm. I just recently went to NUH twice recently because my son had a fever. So I went to the
Oh, that.
A&E.
Oh,
Yeah.
Mm,
So anyway, they and also when he had a cut, so we also went to I just realized
oh.
just I usually go to KK, but it's actually very close to my house. So I might be seeing you one of these days.
Okay. Yeah, yeah, yeah. We will
Yeah. I hope not though. It's not a good thing, but
outside.
yeah.
We will.
Outside. Okay, now let's have Min Hui. Min Hui, how are you?
Hi, madam. Hi, everyone.
Hi.
I'm Min Hui. I'm working in the specialist clinic in Novena, and this is actually a clinic that I never went to because I just recently changed my job. So this is my first week over there. So I'm actually still learning on the way. Yeah,
Oh, what is the specialist? What's the specialty in that clinic?
it is a ONG clinic where
Oh, okay.
option is like a lot of mothers to be. They
Yeah.
come there
Okay.
for treatment
It's
for
a
their
private
follow
clinic.
up. Yeah.
Mm. Okay, okay. So it's your new job. It's
Hmm.
I know a lot of people who like have gotten new jobs but can't start because they've
Yeah.
gotten it like before, and this was like kind of delayed a little bit. So a couple of them were just really eager to kind of start their jobs. But good
Mhm.
that you started, and I think now also it's an interesting time. It's very nerve-wracking for the mothers to be pregnant at this time, right? I'm sure.
Yeah. But
Yeah.
because it's a IVF clinic, so things cannot
Oh,
stop suddenly. So it has to
yeah.
go on as per usual.
I see, I see. All right, all
Yeah.
right. Thanks for sharing, Minhui. So, Vanny, your turn. So maybe you can
Yeah.
tell us a bit more
Okay.
about your work.
My name is Vanilla. I'm working in NUH hospital for 25 years, and I'm have to do assist doctors, and then do have to do the frontline work also. We have to help doctors and plus patients.
Which department are you in?
Eye clinic,
Okay, I see.
and
So
I'm
your
quite
your
happy to
your
work there.
sched schedule is still the same now?
No, now we have to move the patients.
Hmm.
1 week we have to move the patients, and 1 week have to assist the doctors.
Hmm.
So our clinic is divided into two.
Hmm.
So we have to do admin work plus assist doctors also.
I see, I see. So that's the thing right now because of the COVID situation.
Yes,
Our work has changed quite a bit. I
a
mean,
lot
I
actually. In fact,
a lot, right? Yeah, I'm in law, right? So it even then, it's because of the circuit breaker, we've had to have certain measures in place. And of course, I
yes,
think all of us are impacted one way or another, and there's a lot of knock-on effect. But you guys, especially because you are actually dealing in healthcare, and that's an essential service, and
yes,
all the more you're actually seeing people, you've got to try to see what are some of the things that you have to adjust to, right? We're missing Ruth here. I hope she
yes,
pops up
yes.
again. But we will just maybe have a conversation first about that. Those changes that you have seen at your workplace. I suppose for Minhui, you've come in into a new space, so the change may not be so apparent at this juncture. But I'm sure, like I said earlier, mothers, given current periods and times, are probably more anxious. But yeah, I don't know if for any of you, how has the COVID-19 kind of changed your work? What have you been having to do different? And what are some maybe precautions that you have in place? And any interesting stories you have to share about your workplace? Yeah, you can start with anyone. Maybe No. Yeah. Has something changed? How's your routine and your schedule? Maybe in the
Yeah.
office.
Yeah. Okay. Our department now divided into two teams, one clean team and dirty team. Is weird. It's kind of weird sound, right? Okay.
Mm.
When we are in the clean team, actually we are calling all the patients to reschedule their appointment to a much later date, especially the elderly. Because we try to avoid them from coming to hospital with all these virus. You see. So as for the other patients that they really need to come to hospital to see the doctor for their next appointment, and then we got no choice, they have to come, but with a lot of screening, this and that, you see, madam. Yeah, so that
Mm.
yeah, we also ask their symptoms, their history, their travel history, all that.
Mm. So I
So
think the last
yeah.
thing you want is to have patients who come and then they're healthy and fine and then catch something or visit with
Yeah.
everyone. Right? So to just be very careful. How late? How put back is the appointment for some of those who have been postponed?
Maybe for the time being, we postponing them to like 2 or 3 months down the line. But the
Mm.
medication the doctors will be prescribing, and we will be sent home delivery by the Department of Pharmacy. Yeah.
So they're still taken care of and their
Yes,
needs.
yes.
Yes.
And there's also
Okay.
nowadays they have also phone consultation and video consultation.
Oh
They can
yes,
choose that
yes.
also.
Yeah.
Yeah,
Oh,
My
it's very
ours
son
is
has
a
a
convenient.
phone consultation. For
yeah.
my clinic,
Yeah.
phone consultation.
You have one also, Vanilla?
Yes, yes. My clinic phone consultation only, not video.
Phone.
Video. Yes, my
My
doctor
son
would screen
has
the cases.
okay, okay. My son has an appointment as well at KK. Um because of the therapies and all that for hearing. So I've postponed it once because I said okay lah, maybe not so urgent, we can postpone it. But then it got extended. I think it also is not good for him to have it delayed for so long. And then after that he got not well, so I postponed it. So hopefully I'll still get to go soon. I think they have also video consultation options, but it's limited. So I think that's something we have to build lah, the capacity. Ruth, you're back. Sorry, we were talking about how COVID-19 has changed our
Yeah.
workflows and how what we are doing different now. Do you have anything to share? Interesting stories about how work is different for you now?
Okay. For me, I will say that the workflow has been changed. Actually, I was working in a clinic. So at this moment when the April circuit breaker started, so I have to move to dormitory now.
Oh,
So we are selected. Yeah, we are selected now, one by one, each of the people. So I give a hand that I can move with the
you
helping.
volunteered.
I volunteer, so I'm now in the dormitory.
Which dormitories are
So
you in? Is it allowed to, you're allowed to tell us?
yeah, allow.
You
So
are
many things.
you go every day, is it? You go every day to kind of help with the
Now the working timing also has been changed because I work 5 days work, Saturday, Sunday off. Alternate Saturday only I have to work, but now it's totally changed. 2 days work, 1 day off. 2 days work, 1 day off.
oh, okay.
So holiday, I think Labor Day I was in the dormitory,
Hmm.
so I was working. So it's a challenges that I going
You
through.
have you have an inside story. That's very interesting. I think a lot of us only hear it from the news and from what is told to
Yeah. We
us.
we have a positive cases and
Hmm.
non-positive. So we will handle because we are on the PPE, so we are
Hmm.
protected. So we
So the
are
whole
we
time you are there at work, you have to be in full PPE.
yes,
Wow.
madam.
It's very hot, right?
We
And
are we are
I
working. We are putting the mask. All the water is dripping,
oh my
but
gosh.
we cannot touch our face because we have the mask in our hands. So we will do the sanitizing. The workers will come in. We will direct them, bring them to the. I'm on the admin side. My job is
Hmm.
admin, so I have to help the patient. Sometimes they are very fear. They got the fear. that they see us, they scared. Actually, actually, I see them, I scared, but they see me, they scared. The
Oh.
one worker was standing in front of me and giving me his pass, his identity card. So his hand is shaking. I say, why, Maya, you are shaking? He say, no, I scared. And I say, don't worry, okay, everything is going to be fine.
So
So
how the workers generally? So they are, a lot of them are very anxious. So they are
yeah,
being scared.
their BP will be high when they come to our station. Their BP will shoot up. Then we know already, so we tell them to go faster and take their drink and relax and come back again. That will be okay.
Poor thing.
Oh.
Well, you can
I'm seeing a
imagine
lot of
how terrifying it is also for them, right? I
yeah,
mean,
but it is very good, ma'am. I
is
have the
it?
challenges with me because as a circuit breaker. So I find that is to help them in a kind of a gesture. We have to be very kind with them and soft spoken to them because they are coming from other country.
Yeah.
So we motivate them in a way that we are there for them.
Mm,
So they are
yeah,
happy. Yeah,
that's
they are
nice to
happy.
know.
So sad that sometimes they are leaving their family and working for us. So they are happy that we are serving them. So I'm in the Kasia Penjuru
Oh, okay,
dormitory.
dormitory.
I'm
Yeah,
attached there, Kasia.
I see, I
So I
see.
cannot go anywhere. I also restricted already. I have to work hard, work, then go back to work and go back home and
Mm-hmm, of
take our
course.
shower and go back home. So that is
Mm-hmm.
the what the life is going on
And you've
since.
got to be
And
extra
today
careful.
I was
Mm,
off. So suddenly they call me because one of the person is MC. So I have to rush. So it's
no
a kind
problem.
we have to be committed in our helpline. Any
Mm,
holiday, no holiday for us.
mm,
Yeah,
yeah.
that is
So
the
that's why
challenges that I'm
we
with.
really salute the frontline workers and all the efforts that they are putting into this to support the current situation. It's I think COVID has really made us really look into some of the really key issues, about how we treat our workers and make people notice about it. I think make people more aware about some of these things, which perhaps in the past they never really thought of. And so these are things that we can continue to build on. But I think that the reason why the numbers are also so high because we are also testing aggressively, right? Because we're really checking to see, we're
Mm.
making sure. So that's why the numbers are really big. I think it's better to know than to say, oh, there's no cases at all, but actually
Yeah.
everybody's just catching
Yes.
it. So I think we've been very transparent. Our government has been very transparent about it. We have a lot of cases, but so be it, and we're handling it. We're doing our best, making sure that it's addressed, and I think that's an important way forward, lah. Yeah. So the other ladies, how are you guys doing? Tracy, how's work been? Has there been any adjustments, and how maybe your schedules have changed also because of the current situation?
So actually, when the DORSCON level turned to orange in February, our staff are actually split into many different teams to work in different zones within the hospital to minimize contact with each other. So actually, the manpower is quite stretched. And we can't stay in our original office whereby we have our designated table and computers. So we are being assigned to different areas, sharing workspaces and computers with our colleagues from other departments. Yeah, so sometimes we need to take some time to adjust, and then there might be conflicts because we are working with colleagues from different departments instead of just within our own department. Yeah.
Mm. Yeah. So all these little things that we don't always talk about, right? But they're the realities when you have to adjust your workspaces and your schedules and routines. So it's definitely been something that we all need to sort of keep up with. Well, if there's anything else anyone wants to share about work, if not, I thought we'll move on to something quite interesting as well. How has the circuit breaker changed our home lives? That I think a lot of people have stories to share. Maybe you guys can also give some insights as to how, especially for some of you who are like, still working and interacting with people, because you're all in essential services. How is that? Because you are actually still having to work. And I don't know, for those of you who have kids, you have HBL to think about. And how that
Yeah,
has been. Yeah. Yes, Ruth, go ahead.
for me, I'm happy that wherever we take our transport to our work, the fellow people, the drivers, all are praising us and thanking us so much. I'm happy with that.
Yeah.
So the current situation, things have changed a lot of things. And
I
about
suppose
our brand, yeah.
you're guaranteed a seat in the bus or train now.
Yes.
Because it's so empty.
Sometimes I have to take cab and go.
Oh,
I didn't use too much of
the bus and
yeah.
the MRT.
So I
Yeah.
taking MRT okay, but bus is lesser.
Because the routes are a bit
Taking
longer, like usually for the buses,
yeah.
right? So
So
no,
just
you still take the public transport? Do you travel to work? No? How do you travel to
Oh
work?
yeah. Yeah. I'm taking bus.
Uh-huh.
During this circuit breaker, the bus is almost empty. So I was like, the queen in the bus. And then the road is quieter, and we can reach workplace in a short while. Yeah.
Yeah, yeah, that's the
That,
one of the pleasures of. So I think early on, there was a bit of a concern as we were trying to lower the transmission, and because it was very hard to figure out how exactly transmission happened, right? Especially when it was in the community, and we really need to lower down. So the circuit breaker became so necessary because if you don't stop the work, people would still have to travel in the public transport, and there was no way to control that interaction. So I think the circuit breaker came in at the time when it was really necessary to do so. But yeah, I mean, I suppose it's an interesting experience for you guys to still travel to work and
Yeah.
look around. What has been any interesting stories from that? Commuting.
Sometimes the bus driver will wait for us.
yeah.
Yes, yes.
Yeah.
You also have more time now.
Agree.
At the bus stops, he wait for us, and then once we go in, then he will just take the bus.
Also
Many
in your
actually
in your
they got time.
you got
Yeah,
time,
even
and
though
also they
appreciation, they know that sometimes once we miss this bus, the next bus will be taking sometimes to come. So
yeah,
they
Yes.
really will wait for us.
I'm
yeah.
glad to know they do that. That's really sweet. Especially because if
Yes,
you're in your uniform, right? Wow, I think they don't even dare, leave the nurse behind or the healthcare worker behind if you drive
yes,
all the way to school. But yeah, I'm
Nowadays we
glad.
are well treated.
Yeah.
yes. They recognize us, and the appreciation is there, and they
Okay.
will thank us.
That's nice to
Yeah.
hear.
Oh yeah, sometimes there's like gifts from the public. So actually quite heartening and encouraging for us. Yeah, like sponsored lunch and all that. Yeah, quite a
Yes,
lot.
yes.
Oh, that's nice.
My clinic also had a lot of sponsored lunch.
Oh,
Wow.
that's nice. Actually, that's one of the sweet things, right? You out of the situation, you see nice gestures from the
Yes,
public people. And I think maybe because, when we were so rushed with work and the usual routines of the day, you hardly have time to kind of pause and take stock of important things, acknowledge people for the work that they do, thank them. So with this, you kind of took a pause lah. And I think, yeah, the fact that the public came up to put in the appreciation. And this is very interesting because if you remember very, very early on, when I was going on house visits, and this was very early on, some of the healthcare workers were sort of sharing with me how people stayed away from them.
Oh
Um,
yeah.
yes,
because they saw you in uniform and then they were like, alamak, in case they got COVID or something. So they would stay away. And I thought that was
yeah,
quite,
yeah. My friend experienced that. The taxi driver just go off. He
oh
said,
my
Don't go to hospital."
Really?
yeah, and this I suppose was out of lack of awareness and all that. So I'm glad to see a whole, turn around, 180 degrees turn around of that approach and attitude, and people thanking and acknowledging you. and knowing that hard work that you do. So I think that's wonderful. So I was about to move on to more of the home experience because all of you, in your own capacity as daughters, mothers, wives, also have to deal with the circuit breaker and whatever that comes with it, like children staying at home or having to manage that. I'm not sure if any of you have any interesting things because there's some things that we can't do as per normal, right? Because of the
Yeah.
services. I
Mm.
don't know if you have anything to share. Maybe Minhui, anything different or what's your story like at home with the
Okay, because
family?
of this circuit breaker, only essential services are actually allowed to continue. So actually now is that if let's say there's any emergency situation, then only my father was electrician, so he has to only attend to an emergency situation. So that sort of changed his lifestyle because he usually be the one who is going out working. So now this COVID circuit breaker actually turned that around.
And you get to see him more. You get to spend more
Yes.
time with him.
No, but
That's
actually I'm working,
because
so
you are out, yeah, you're out at work as well. I
yeah,
suppose
so
for essential workers like you, a bit hard to say you have more time with family because you also have to work all the time,
yeah,
right?
correct.
You're out. But what has been different? Like how have you been managing some of those changes? Hasin maybe?
So I have one preschool kid attending childcare. One of the challenges is the childcare arrangement. So we have the option of sending my kid to the childcare because I'm in the essential service, but we prefer her to stay at home to minimize the risk. So I'm thankful that my mom is actually able to help care for my preschool kid in addition to my 1-year-old baby. Yeah,
Oh,
so
wow. I have to salute you. My son is 3. He's been extra cranky lately because he's not well, but um, small kids are very hard to manage. Ruth, you have a granddaughter, right? And I don't know how that is in the household because they want attention, and I think sending him for classes and all that actually helped in the whole routine, because there's time away and you can kind of do your own things, and you're also making sure that they are learning something. But then they are home with you, and you kind of have to figure out what to do with that and really ensure that childcare is taken care of, especially when you need to do work. So that I think has been quite a challenge for some families. Yeah.
yeah, and
So
yeah,
yeah.
I think there's this home-based learning activities. So like weekday, I cannot follow up with her. So I have to spend my weekend like trying to follow up on her home-based learning activities. So weekend also, I supposed to have a part-time cleaner coming to my house to help up. But because of this circuit breaker, then there's no helper. So weekend is actually more busy for me. I have to like do housework and also take care of the 2 kids and then following up with the home-based learning activities. So yeah, quite busy and tiring. Yeah.
That sounds like quite a challenge, man. Because I can completely relate. I don't have a domestic helper, so we've also been relying on cleaning services. And for that, they come every week, and I always have that sense of um, assurance to know that okay lah, never mind, I can mess up, and then someone will come and help me clean it on a certain day, right? And it will be fresh and clean again. So now that's something you've got to factor in as you're doing your weekly routines. But yeah, so fortunately, my husband's quite hands-on, so in fact, he's the one who is like managing, like okay, the floor feels funny now, I got to go and vacuum and all that and mop. So I've been fortunate. So, yeah, that's just been something different. Maybe Noor, you can share with us how has Ramadan been. That's also
Hmm.
something quite
The good,
poignant for the
yeah,
community.
the good things about my workplace, they gave us a few um, minutes earlier to go back for us to prepare. So yeah, earlier than our usual knockoff time. And as for the community, our MAC, we are still keeping in touch with them
Oh, okay.
in WhatsApp, and and sometimes we do video call. to see how they are doing. And actually, they are looking forward for our
Iftar.
weekly breakfast.
Oh yeah,
Maybe
on Sunday
after
because
the
we have the
Hari
elderly.
Raya.
Yeah,
Yeah.
and a lot of your sort of participants are elderly residents, right?
Yes,
So
yes, yeah.
this is like their hangout, their gathering, and so I'm sure they miss it. So I'm glad
They're
to know
very
that
happening.
I'm glad to know you guys are still in touch via WhatsApp.
Yes, yes, we do.
Do you do Zoom? You should teach them how to do Zoom and maybe like have a gathering
That
together.
one
Do they do that?
we got to teach them, madam.
Yeah, you should you should try. We had that our
Yeah.
PCC meeting recently. So I was sharing
Yeah.
on Facebook. It was quite interesting because you could hear, because some of them don't turn off their mic, right? So they go, then how? If I want to see how do I turn on? How do I? The
But
grandson or the
I just afraid everyone will talk at the same time. you know? Yeah.
we need to teach step by step. But it will be so nice, I think, for all these elderly to kind of. I think they'll be very excited. If not, also the other thing is house party lah, but it's a limited number. Zoom has
Yeah.
more,
We did that with
yeah, because
my siblings. Yeah, very nice.
yeah, and then you can play games and draw
Yes,
things and stuff
yes.
like that in the
Riddles,
party.
yeah.
Yeah, the all the general knowledge questions. So these are things that I think is interesting because now I mean I find that it's also quite for at least for the Muslims, right, because it's the fasting month, you're kind of made to go and pray at home because you got no excuse really, right? So you can't go out anyway, so you got to be home and so do your prayers unless you're working, but
Yes.
most people would be home. So I think we've been pushed to do some of these things that we maybe didn't earlier on spend time on lah. So yeah, that's been interesting. So it's interesting that you're still keeping in touch. I don't know whether Benny and Ruth, you guys are still in touch with your IC members or even
Yes,
for
yes,
yourself,
yes.
Hui
In
and
chat
Christine,
groups.
chat
In chat
groups.
groups.
Ah, okay. What do you guys talk
We get
about?
actually at the moment there's no meeting, but what is the outcome? Next meeting, this kind of things. All then to plan to go out, this kind of things. All we will talk, but at the moment it's stopped.
I see, I see. Yeah.
Supposed to go
But
bowling.
Yeah,
Supposed to go
yeah.
bowling, but
everything is
because
stopped.
of COVID
I'm
19, it's
missing
stopped.
everything.
Mm, yeah, well, our lives
Missing.
have changed a bit, huh? I
Yes.
Yeah.
was I think yeah, you guys also should really try and see. I think it'll be fun to have everybody try and come on board on especially if they haven't done it. Because I think the first time is always the novelty and always fun to have people come on board and actually try it out and be excited about it lah. So with Peisin and Minhui, are you still keeping in touch with your fellow grassroots leaders and your volunteers?
Yes, we have a WhatsApp group. We
Mm.
still actually keep in touch with actually like regular module that they send out through the WhatsApp group to let us keep in touch with the trainings and everything.
Oh, I see. So they give trainings through the WhatsApp.
Yeah, like it's a short module that they actually post in the WhatsApp group.
Oh, this is the PA trainings.
I think so.
Okay, that's
Like how do we
useful.
manage rumors? How do we
Ah,
manage
okay,
that?
okay. That's quite useful. My one of my bigger challenges right now, because I was quite dependent on some of the grassroots leaders, especially in the RCs, to kind of help mediate some of sometimes when residents are unhappy with each other about certain
Yeah,
things.
true.
Um, so of course I will get HDB and sometimes town council involved to help. But nothing beats having a fellow neighbor or a grassroots leader within the community to try and calm people down and have a conversation. So in the past, before COVID-19, it was a bit easier to kind of deploy and ask the fellow neighbor to talk to each other and all that. But now I can't put them out like that, and it's the circuit breaker period and it's also very risky anyway. So
Mm.
we've had to pause some of these things. And yeah, that's been a big challenge because the complaints still happen. I think people still have issues sometimes. So yeah, that's a little bit harder to manage, but we're trying. But yeah, I really miss the grassroots leaders and all the different engagements. We we used to meet more often, and then now we don't have that opportunity to anymore. So yeah, but I really didn't want to also I think we were all very strict about it in not wanting to create engagements. I know some of you also volunteer, like I mean towards the end with at the CC at the counter and all that. I think I'm really grateful for that. I think as much as possible now we want to also protect our volunteers and not expose them too much to interactions with people out there. So yeah, that has been interesting. Anyway, I hope it's been you guys are being able to also spend some time with your family. I mean, that's one thing that's been most meaningful for me at least, because I um I don't have to go out so much, right? And so I have more time to spend with my husband and son. Um, of course, as I get busy with some of the things that I do in a day, um, he's just running around, and then I'm just letting him do that. Otherwise, yeah, we still have to interact, and we still have to um, uh, finish up our work and still manage that time. But yeah, I mean, I've been really appreciating the time I've had with my family. I'm seeing that people are
Yes.
asking questions.
Any
Answer
tips?
this. Answer is asking
What
any
is the
tips for
tips?
cooking a good and fast meal at home. Oh, actually, I'm looking at a lot of some live comments. Maybe I don't know. Must be no lah. Your anak saudara say hi Mak Long. Must be you.
We've not been seeing each other for long.
Oh yeah, that's the thing. Yeah. Hi Jenny and Max. How are you? Hi. Well, do you guys have tips for cooking a good and fast meal at home? You guys cook? Christine, do you cook at home?
No,
Sandwich.
no.
Damn it. You know that one of the things that run out quite quickly is the baking ingredients, because people were baking a
Yes,
lot
yes.
in the circuit breaker,
Yeah,
right?
agree.
I
Yes.
understand that yeast was out of stock and all the flour and all that out of stock because people were making bread and all sorts of things. So that's been interesting. But no, you cook, right? You cook
Me?
or yeah.
During weekends, yeah.
So do you have any tips for a good and fast meal at home?
Yeah. I like to try new recipe actually in the YouTube.
Oh, yeah.
Yeah.
Wow.
Um,
Nice.
no, that's good.
What have you tried so far?
Your latest
So
adventure.
far, yeah, some still like the Malay, the olden Malay quiz. I try to make it
Oh,
again.
really? I'm
Oh,
planning to
really?
try and make onde. They say it's actually very easy, but I don't know whether the
Okay.
ingredients.
Only if you see a certain recipe is really you can really make it like the taste like the old days. But sometimes the recipes doesn't really
Match.
suits
But I
it.
thought it's
Yeah.
supposed to be quite easy because it's just flour and then you put
Yeah, flour. Yeah.
No,
then you
actually,
just
it's
put
tapioca, right?
the
Yep.
It's
flour, yeah.
tapioca.
Only
But
right?
You
Yeah,
must
tapioca.
boil.
Yes.
Yes, yeah, only it's tapioca. It's not mainly flour only.
it's
Yeah,
tapioca flour,
tapioca.
right? It's some
No, no,
sort of
it's. I mean, when
Yes,
I
because
was
it's a bit like
in school
sticky,
time,
right? Yeah.
they teach
see.
us it's a real
So you
tapioca.
with tapioca and not
Oh,
I see. I
You
think
must
the
wow.
boil the tapioca and then you must add some starch, flour.
okay. I think the recipe I look at is not so complicated one. But
Yeah,
yeah,
actually, only is very simple way.
The
yeah.
easiest is pudding, agar-agar. That's the easiest.
I think fast meals are for me really looking on the YouTube. There's a lot of those videos that are like 15 minutes with 5 ingredients, all those kind of things. Like those things I can do lah. So I do like pasta so far. Or
Wow.
bake something like
That's
the fish.
great.
I just marinate
Pasta.
and put in the oven. Very easy, like cannot go wrong because it's burnt and nobody can see. Flying. So I think those things. Yeah. Oh, I think Henry has some interesting suggestions. How about some home activity kit and maybe an optional Zoom workshop for the elderly? Yeah. Actually, we really need to figure this out, no? Maybe, you can pilot it with your elderly. How to try and teach them to use Zoom. Maybe we could reach out through their children to
Yeah.
tell them,
Yeah.
hey, you can try and just show them the app, and then after that, it's just not too bad lah, because it's fairly user friendly, right? You just have to key in the number and the password, and then you can be into a meeting. So I think we should try making an effort. And actually, there's a lot of things now online for the elderly, like the TV shows, and even in the because it's Ramadan month, they've also got like lectures and all that online now, on the TV channels as well. And so these are things that I think the elderly can be entertained with. But I think nothing beats catching up with their friends. So I think this Henry's idea is something maybe we can try and think about. If we have their numbers, if they have at least data plan, we can try and teach them how to. Because with Zoom, you just download, then you click on the link, and then you are in, right? So maybe
The
that's something.
password. Is it? Yeah.
The
If you
password.
have the link, with
The
the
link,
link, you
yes.
go there. So maybe
It's
that's
quite
one
easy
thing.
actually. Yeah.
Maybe we can slowly. I can try with my parents first and see. So far, we've only been using WhatsApp call lah. So yeah, a lot of people saying hi
What's
to us. Mhm. Yeah. Sorry, you were saying just now, no?
no, like even the WhatsApp video call now, you can like 4, 6%, is it? 4?
Yeah.
I
Now they have.
yeah.
You
Yeah.
can include more people.
Can
Better.
right now?
Yeah.
Yeah.
Can.
So it's
That's
also
I
easy when
tried
you.
it.
Yeah. So maybe with the group, you can try with WhatsApp first, then later on with Zoom, and we
Because
can do other things.
I'm chatting with my grandchildren in
Yeah.
the WhatsApp. They will play with me.
But people
They will
who
laugh.
who will be like, huh? She has grandchildren. They won't believe.
that.
Now in the video can't really, But you
I'm
you look very
really,
young.
I really missing them.
I know. I'm sure.
I really
My
miss them.
my brother's wife gave birth. Haven't had a chance to see him yet,
Oh,
and
Mm.
yeah, so sad, and they cukur
oh,
rambut and all that. So he had done it already, and so some things we
oh.
missed out because of this timing. But hopefully, I think this all kind of keep our feelings for
Yeah.
each other. So hopefully, when the circuit breaker ends, we will appreciate our family members and the people around us better. I think we're almost like 15 minutes towards the end of our show. Thanks for
Yes.
being my star in this
For special show.
Yeah.
our maiden PE
Hope,
talk show.
hope to get again.
Sorry?
Hope to come back again.
Yeah, let's do that one day. But I thought maybe I'll give a chance for each of you to say your wishes or your hopes or what your takeaway is for this period and what you hope to look forward to in the future. Maybe we could start with Benny.
Okay. My wishes for everybody actually is be safe and stay unnecessarily. Don't go out from the house. Take care of the elderly parents. That's the important.
Yeah, yeah, I think that's true because we all have sacrificed so much. I think we should do it right. If someone doesn't take it seriously, I think it will affect a lot of us, right? Because it's not just
Yes.
about themselves, but how they will impact others as well. So I think that's very good advice from a frontline worker. So listen, everyone. And then maybe you have something to share with us?
Okay, so everybody, I just hope that everybody be safe and stay home until this period. Definitely we can get through this together.
Thank you so much. Yes. I think it's so important that we continue to rally people because we should all know that we're not alone lah in this,
Mhm.
right? So
Yeah.
if we look out for one another, that's something that is something we should keep doing during this period. Maybe I'll go out this round. So Pacing, your turn.
I think this is a difficult and challenging period for everyone. But let's do our part to fight against COVID and stay positive, stay safe.
Thank you so much. I think it's um, it's very easy to get how do you say stressed out, right, during this period, very angry, harassed, why things are the way they are. But I think we can choose either to be very upset about it, or like Pesin say, we can be positive and hopefully make the best out of our situation lah. Yeah, so thank you so much for that message. Maybe Ruth, you'd like to have a go.
Okay, my concern for everyone at this moment, because I'm working in the dormitory. So at this moment, circuit breaker, please stay at home. Important is be healthy. The healthiness is take care of your health, like wash, like take some good food, fruits, drink more water, like 8 hours water, but try to not too much, but limited, and take care of your health by don't eat spicy food. Then what I want to advise you all, anywhere you go, sanitize your hand. That is the important. Like you go out, you come back home, sanitize or wash your hands and wash your legs. So the better is prevent the crowd. So that is the important that we are learning in the dormitory. So stay safe, everyone. I know you love your loved ones, but be safe.
Mm.
That's all I can say. Take care of your health.
Thank you so much, Ruth. Yeah,
Yeah.
maybe Noor, you have something to
Uh,
say also to
yeah.
some of our Malay viewers who are celebrating Ramadan.
Yes, of course. Okay, have a blessing Ramadan for all our Muslim friends. And oh yeah, can I also wish a happy Mother's Day in advance? So this, yeah,
Oh, yeah.
Yeah.
to all mothers, to you,
Oh,
madam, and to all. And
Thank you so much.
stay healthy, wash hand regularly. I think prevention is better than cure. That's all.
Okay. I've got something else to request of all of you because I know this one is free. I don't even pay and still got to make you work so hard. This show. But we have viewers I think from different backgrounds and those who may not be able to speak English. And I notice you guys are all from multiracial. So maybe I can request some of you to actually give some um, very encouraging messages in Tamil, Malay, and Mandarin, or some dialect, Hokkien, or if you can, maybe one, everybody says one line or something like that. And
I'm
before
not
we
good.
simple lah, just to
Start with who?
encourage them. You can face it, you're on. So
嗯就在这个时候，就是大家都就有很多在这个时候，就是大家都有一些困难所以就尽量保持开朗的心情，然后就是尽我们的一份力尽量待在家。Okay.
thank you so much. 谢谢 Pesin. Anyone else? Benny. Black one.
ஓகே வணக்கம் எல்லாருக்கும். பத்திரமா வீட்டில் இருங்க, அடிக்கடி வெளியே போகாதீங்க. முக்கியமான விஷயத்துக்கு வெளியே போறதுன்னா போங்க. உங்க பெற்றோர்களை கவனிச்சுக்கோங்க. இப்போதைக்கு நீங்க தான் அவங்கள பார்த்துக்கணும். எதாவது அவங்களுக்கு தேவையா இருந்தா நீங்க அவங்களுக்காக போய் செய்யுங்க. அதுதான் முக்கியம். ஏன்னா நீங்க குழந்தையா இருக்கும்போது அவங்க உங்களை பார்த்துக்கிட்டாங்க. இப்போ உங்களோட டர்ன், நீங்க அவங்கள பார்த்துக்கணும். தேங்க்யூ.
Nandri, thank you so much. No, your turn.
This is for
Oh, you can say in Malay.
for
You must say
for
about it.
oh, the
For the residents, to the people watching us today.
okay. In Malay. Okay. Jaga diri. Jangan lupa cuci tangan setiap kali selepas melakukan apa-apa riadah. Sangat penting. Dan sempena bulan Ramadan ini, selamat menyambut bulan Ramadan dan Hari Raya yang bakal menjelang. Jaga diri, jaga kesihatan. Terima kasih.
Terima kasih. Thank you so much, ladies. Oh, yeah, I think the admin is still going around. Min Hui and Ruth are on.
这个时候大家都有困难，我希望大家都尽量忍耐出这个时期，大家一定可以通过这个时候，尽量保持愉快的心情，不要太过有压力。谢谢。
压力 stress, right? Don't be stressed. Ruth.
ஹலோ, எல்லாருக்கும் என்னோட மரிமார்ந்த நன்றி எல்லாம் அந்த ஒர்க்கர்ஸ்க்கு. ஸோ என்ன நான் சொல்றேன்னா, எல்லாரும் பத்திரமா இருங்க உங்க வீட்டுல, எங்கேயும் போயிட்டு இருக்காதீங்க. கூட இம்பார்ட்டன்ட் வந்து வயசானவங்க தான். ஸோ அவங்கெல்லாம் போனாங்கலாம், லைக் நீங்க வந்து ஹெல்ப் பண்ணுங்க. லைக் கூட போய் அவங்கள நல்லபடியா கூட்டிட்டு ஹாஸ்பிட்டல்ல போய் ஏதாச்சும்னா ஹேண்ட் சானிடைசர் பண்ணுங்க. ஸோ அவங்கள பத்திரமா வீட்டுக்கு அழைச்சிட்டு வந்துருங்க. ஸோ நான் எல்லாருக்கும் சொல்றது வந்து ஸ்டே சேஃப். தமிழ்ல வந்து கொஞ்சம் கஷ்டமா இருக்கு எனக்கு பேச. ஸோ எல்லாருக்கும் நான் என்ன சொல்ல வரேன்னா, நல்லபடியா வீட்டுல இருங்க. ஃபாலோ த ரூல்ஸ் ஃபாலோ பண்ணுங்க. அவ்வளவுதான் நான் சொல்ல முடியும். நன்றி எல்லாருக்கும்.
Thank you so much, Nandri. Thank you, ladies. Really, I really appreciate the time that you spent here, 1 hour preparing as well as going through all the different sharing that you did. I'm really grateful, and I hope this has been something that is meaningful and our way from us, the grassroots team at Bukit Batok East to reach out to the residents. So I look forward to having other opportunities. If you're watching us and you have suggestions or ideas as to what else we can talk about, who else we can talk to and engage, I would love to hear your thoughts and suggestions. Just wanted to remind you, Mother's Day, Noor mentioned earlier, we actually have a Mother's Day tribute live on Sunday, 10th of May at 10 a.m. So if those of you who are also available and keen, please come and join us as well. And I really hope to physically see all you ladies again soon. I think this has helped to ease a bit of the how we're missing each other, lessen that a little bit, but I really hope in time we'll be able to see everyone, and also in time be able to hug and hold everyone again. So my best wishes to all. Thank you, Nandri. Terima kasih. Selamat malam. Cuaca ping pingan an, cantik cengkang. Okay, take care everyone. See you.
Bye-bye.
Happy Mother's Day.
Happy Mother's Day.
Happy Mother's Day.
Advance.
Harap semua.
Mother's Day advance.
Okay.